Hello, and welcome back to Cancer Watch, a public health program on cancer awareness brought to you by the Common Cancer Foundation and partnered with Archon, proudly sponsored by Plus TV Africa. I am Dr. Denise Ejo, the CEO of Common Cancer Foundation, and today's episode could be the conversation that saves a life, maybe even yours. Together we fight, together we win.
Hello everyone, I remain Dr. B. Olutunde, a clinical oncologist representing Archon, and today's episode is titled Breaking the Taboo, talking about testicular cancer. It's a subject that is rarely discussed, but is really important.
Did you know that testicular cancer is the most common cancer in young men between the ages of 15 and 40? While it's relatively rare, overall rates have been rising globally, and the burden in low and middle income countries, including Nigeria, is underestimated due to limited awareness and poor data collection.
The good news, though, is that testicular cancer is one of the most treatable cancers when it's caught early, with cure rates of over 95% in the early stage diagnosis. The problem, however, is that in Nigeria, most men delay getting help, often due to shame, fear, or simply not knowing what to look for.
So today, we're breaking the silence. We'll talk about what testicular cancer is, why it matters, and what every man, and the people who love them should know.
And joining us to demystify this illness is a leading voice in cancer care, a man who speaks volumes in the fight for life. His name is Dr. Charles Percy Opani. He's a consultant urologist and a senior lecturer and a fellow of the West African College of Surgeons, urology with special interest in uro-oncology, renal transplantation, and male infertility. He's joining us from Port Harcourt in Nigeria.
Hello, everyone.
Cancer Watch, Dr. Charles.
Yeah, Dr. B, thank you, everyone. Hello, everyone. Dr. Dennis, good to be here. It's an honor to grace this discussion where we speak to save lives of young men for this underreported but getting relatively common cancer. And I hope at the end of this, more than one person will seek care when it's needed. Thank you very much.
Thank you for joining us, Dr. Charles, and thank you, viewers. Now sit back, relax. So before we dive in, let's take a moment, share this broadcast, follow us, and subscribe to Common Cancer Foundation, Archon, and Plus TV Africa, because every share could lead someone to early detection and discipline. So relax as we start this conversation. And my first question, Dr. Charles, what is testicular cancer?
Yes.
Essential to talk about it.
Yeah, so two key words there in that statement, testicular and cancer. So testicular, of course, is the testis, the male organ, the two eggs in between our legs that help men have children, that definitely divides men. And then cancer is abnormal cells growing out of proportion. So testicular cancer really means is when you're having an abnormal growth in one or both of the testes that is growing out of proportion, and it can spread to other parts of the body to cause harm. And it should be discussed because, like every cancer, it can, over time, if not treated on time, overwhelm the person, invade other parts of the body, take over the body's blood system, immune system, and ultimately lead to death. So it is important. We are saying it commonly, and like I said before, in young men, 15 to 40 years, it can occur in all ages, but 15 to 40 years is one of the key age groups that you see a lot of testicular cancers.
Wow, thank you, Dr. Opani. Very interesting, really. And a man's crown jewels are one of his prized possessions. So how would someone watching this program right now? How will someone watching know if he's at risk or of the disease, or if he already has the disease already? How would they figure this out?
Yeah, so testicular cancer can occur in any man. So every man should be watchful. Of course, the crown jewels, when you take your bath every morning, one of the areas and you can get to feel it. And I want to put it here that there's a lot about self-breast examination, but little about self-testicular examination, which is a thing, which is one of the things we are going to discuss. Every man should be able to feel his testes. You feel it like a round bean egg with a head, a cap. I feel that it feels normal. But there are also some situations that may make a man a bit more susceptible to coming down with testicular cancer. If anybody is found has ever had a similar illness, it's very important. If the man has cancer on one side and that has been treated, he can have cancer on the other side. If he has a family member, maybe a father, an uncle, or a brother who has had testicular cancer, he has a risk. And then there are environmental factors that are important. Exposure to radiation is very key. We've had people who maybe they work in the airport scanners, or they work with radiation. People within the medical sector that work with radiation, they can have increased chance of testicular cancer. Then exposure of the private part to petrochemicals. You know, where we had the coal industry that was quite active then in Enugu, and they were having exposure to that, to the private part, it had an increased risk of testicular cancer. And then sometimes it's being related to some infections, like viral infections have been also seen. So a lot of those factors. But the key thing is familial. So you have a family member that had it before is important. You work with radiation, petrochemicals, you are in an oil producing area like in South in Port Harcourt. People in that environment have an increased chance. Then lifestyle also, smoking has been associated with testicular cancer also. So these are some key factors. But I want to say that those factors may not be there, but every man can have it and should always check his testes every day if possible. Thank you.
That's very interesting. Important that men should actually take note of this. So let's go on to the next one. So why are men so silent about their health in Nigeria, especially when it comes to their private parts? And how can men perform these self-examinations? There are two questions. But the next one is, how can we now get men to create a culture where they are not afraid to seek medical help?
Yeah. So, like you said, it's a cultural and an environmental thing, and it's not just within Nigeria. Worldwide, women tend to have far better health-seeking behavior than men. There's a tendency that a man will come if he's not having good erections, but will not come if his testis is swollen. In that area, for a man, seems to be private, will just keep it there. So we have noticed that a lot. It's just to encourage men, really. And for every part of the body, you have an abdominal swelling, just pop in to see a doctor. And then there's also this myth that if I go to the doctor, I always find something wrong. So, that's also a cultural problem we have. Now, when it comes to self-testicular examination, it's a simple process. You're taking your bath. You have two testes. So the first thing is, look, I'm feeling it. We call it the egg. So it feels like an egg that has like a cap on top of it, like a small part about it that's really not well filled. So you feel it, you touch around it, it takes you a couple of 5 to 10 seconds while you're taking your bath. You feel it, you find, is there any area that looks bumpy compared to what was not there before? And then the texture. So you want to know the texture. So generally we expect that the texture of the testes should be closer to as if you are pressing the bridge of your nose. So it has a firm texture. Yeah, but when I start getting you are feeling the testes and all feels okay at the bridge, and then you get to a part where it's not becoming hard like the forehead, then that area looks abnormal. Then another key factor which can trigger every man to know there's a problem is, there is this sensation when a man touches the testes. You feel this, it's not a discomfort sensation. It's not pain, but if it's just pressed. So if you are pressing your testes and you don't feel any sensation, then you should immediately go to the doctor, because that's a high chance that testis may have a cancerous growth in it. So absence of sensation when you touch the testis is an important finding in a self-testicular examination. Yeah.
Oh, wow. Interesting. But then one thing I want us to look at is the culture of the fear.
Yeah, so it has to start from the homes, really. Men have always really have been seen to be infallible, all strong, we can't fall sick, and all. And then, if a man has a fracture of the hand, yes, I need my hands to work, I get it sorted out, or I have something. But when it comes to something that hidden under the clothes, most men will not even when they come to hospital sometimes, they are not even willing to say the problem until you have to push them and try to convince them. I say, okay, I think I noticed a swelling, but it looks normal. So, but we have to change that culture that, look, every part of the body is important to be taken care of. And look, we call it the crown jewels. A crown jewel should be something where you should inspect it and make sure every single jewel there is complete and in order. So we have to work on that. I think it starts from the home. It starts from the upbringing of the children, of the boys, to say that, look, if we have a problem, speak out. We see that not just in issues of the testes, not just cancer. We have what we call torsion, which is cut off of the blood supply. We have these issues where young boys are not speaking out because they feel their private part and it should remain private. So yes, it's private part and it should remain private, but if he has an issue, you should speak out and seek medical help. And I think it starts from the family upbringing, really.
Thank you very much, viewers. We're going to take a break now. Remain with us as we take a break, and we'll come back in a few minutes. See you soon. Welcome back, and thank you for staying with us. Together we fight, together we win. The conversation continues. We're talking about breaking the taboo, talking about testicular cancer. Please always understand, I'm not a medical doctor. Okay, so we continue the conversation.
We do. And Dennis, you're doing awesomely well. So, Dr. Kwani, thank you so much for staying with us. I have a big question. We're a deeply religious and cultural nation, talking about Nigeria as a whole. What do you think the role of religious and community leaders is in encouraging open conversation about mental health? You had already mentioned earlier that people find it difficult to talk about even in the hospitals. How can we engage religious and community leaders to play a role, Dr. Kwani?
Yeah, you raised a very important point, and I think these are the key stakeholders in ensuring that people seek better care of their health. Religious leaders are influential in the life of many Nigerians, if not most, whatever religion it may be, and we have to be able to drive the fact that from the religious perspective, that the pastors, the imams, from their pulpits at the point of talking to their people, have to encourage them to seek health and healthy behaviors and seek out good care if they fall ill. And it's important. And even if you dive into most of the religious books, seeking out health care or seeking help from a doctor is not bad. In fact, it's encouraged. So we have to be able to talk with our leaders, and if you are a pastor, a religious leader, an imam, you are listening, a community leader, and you have the forum where you have a meeting, you can just chip in a 2-3 minutes talk about the need to see a doctor if you have a problem. And it's important that that has to be done. And then also, we know some religious associations and societal groups are doing it now, where they getting a medical professional to come in and talk about some health problem. And for testicular cancer, it's very important because there's a tendency to talk about women, about childbirth, about breast cancer. Breast cancer is a high burden, yes, but we have to come out that when men also will come out and push for discussions on testicular cancer. Of course, prostate is there, but for testicular cancer now, and because it's targeted at a younger age group, for 15 to 40, age group where energies are high, you're meant to be active, you're not expected to fall sick. You understand? Nobody expects anybody 15 to 40 to fall sick in the active age group. But it's good to know that in that age group, you can have an illness and it could be a testicular cancer. And like has been said, it is curable if caught on time. It's one of the easiest curable cancer. Even when there has been some spread, you catch it and you start on treatment, you can achieve 100% cure. And that is the beauty about testicular cancer. So hope is not lost if care is sought at any point. But of course, the earlier, the better. So we want to encourage our religious leaders, our societal leaders, our traditional rulers that we need to encourage our people to seek out and look after their health. It's nothing wrong about it. It's not shrouded in mystery. The knowledge of medicine also is embodied and come from basis of religion also and has been established on that. Thank you very much.
Thank you. I always make this statement, and maybe because I live with cancer, I always say the Bible. I use Christian. I'm a Christian. I always say the Bible always tells us about Peter, the physician, and because referenced, that means a doctor is important. So viewers out there, please listen to what they're saying. I'm going to ask you the next question. What would you say to a Nigerian man who is embarrassed? That's the key word. Is the embarrassment that is the problem at this point? Now, it's very specifics. These are things you need to do now, mister. If he's embarrassed, is afraid to seek help. So I want them to be able to pick up points, because somebody out there is watching this and they will decide that they've forgotten half of it and leave it alone. So if they have very key points, the chances are we'll get solutions.
So we're focused on testicular cancer. So you're a man out there, whatever the age group, or you have a child, a young boy, and has a swelling of the testes. The first thing is, if you have been doing some examination on yourself, you will know that if you compare the two testes, one looks bigger than the other, one looks harder than the other, one of them you can't feel the sensation. The first thing is seek help. Healthcare may look expensive, but really when you seek healthcare on time, it's cheaper. You understand? So you walk into a hospital that has a doctor, primary, secondary, or tertiary level, and complain that, look, I have the swelling on my testes, and I feel worried. The doctor will want to just examine it, and most likely send you for an ultrasound scan, which is available in most cities in Nigeria. And when that is done, they may refer you to a urologist. So I think it's the mindset of, first of all, we have to decide that, look, when we are ill, if I notice a swelling in my testes, I will go and seek out help. And help is always there. But also another thing we are emphasizing is self-testicular examination. Examine your testes. If you can't do it every day, at least twice a week, feel around it, feel anything. If you are married, look, you could get your partner to help you. Do that also, because a woman will always want her husband to stay alive or a child to stay alive. And if you notice anything abnormal, especially like I said, you are touching the testes and you're not feeling any sensation at all. It's as if you're not touching anything compared to the other one, then you need to see a doctor.
And Dr. Charles, I feel like one important thing that to talk about embarrassment, like Dennis was saying, is people just find the idea of another human being examining them, touching them in their private. It can be a big deal. But I know that doctors, you do this so often, we do this so often, it's really not a big deal to be embarrassed about, is it? Should how people get over that they're concerned about, oh, I don't want someone to touch my privates? It's a bit invasive.
Yes, and it's always going to be, because like you say, it's a private. You call it the crown jewels. You don't get to see the crown jewels except you get into the place where it's kept on display, really. Mm-hmm. But when you understand that those same crown jewels, those private parts, which is the essence of manhood, which helps you in reproduction, because that's where sperm is produced, where the male hormone is produced, can be lost because of not care. So the idea that, look, I can lose my crown jewels should make you seek out the best way to get it okay and get it checked out. So there will always be an embarrassment. You always feel odd. Yeah, and that's why in the place of going to see a doctor, and ideally every family should have a family physician, even it must not be a specialist, any doctor first that can first of all see and take initial assessment. So I think it's a mindset change. When I look at it, I look at embarrassed to show my private part and happen to examine. But if I lose my private part and I'm dying, everybody in the world is going to see it. If you come in, when we see people who come in and the cancer has spread and they don't know themselves, everybody is saying that. You understand that? But if you go at the point when it's controlled, you're walking into the consulting room, you're seeing the doctor, you're confiding in the doctor, he's examining you in 2-3 minutes, and the place is well protected and all, and you come out and nobody knows why you went in there. It's better than coming as an emergency.
I'm going to ask you our final question, and these are just statements. Please give us a message to the government on this particular discussion.
So,
one thing that the government should do as we round up.
One, there has to be policies targeted at health education on testicular cancer, and it should be incorporated even into school curriculums, where people know that, look, I know some schools are doing it for breast cancer, but testicular cancer, it should be incorporated, and the message should be that a young boy or an old man, anybody that has any abnormal, either a swelling, a pain, a hardness in the testes, should seek help. And the second message is that the health institutions have to be structured to be able to handle this when it comes. There should be a clear referral system and adequately equipped hospitals with doctors who can see this and treat it on time. And of course, I know there's some cancer support for some cancers, breast and prostate cancer. There are some cancer support for them. Testicular cancer should also be included in that list if it's not already there. Thank you.
So as we wrap up today's episode of Cancer Watch, let's remember the key takeaways from the important conversations on this discussion. So number 1, testicular cancer mostly affects young men between the ages of 15 and 40. And though it is rare, early detection can lead to 95% survival rate.
And number 2, a painless lump, swelling, heaviness, loss of sensation, fullness in the scrotum are early warning signs. Don't ignore them, please. Do a self-exam monthly and see your doctor immediately you spot something. Number 3, silence kills, and as Nigerians, we must break the cultural and social taboos that make men feel ashamed to talk about their bodies. Just seek help if you need to.
And number 4, seeking help is not a sign of weakness. Trust me, I live with cancer. It is a sign of wisdom. 9 years on, encourage the men around you to speak up, get checked, and take charge of their health. And number 5, community and faith leaders must be part of this solution, please. Using your platforms to educate and empower men on health issues allows women to not have to end up without a father figure for their wives and children.
Absolutely. So let's keep this conversation going in our homes and communities, and the more we talk about it, the more lives we can save. Thank you everyone once again, and thank you to our esteemed guest, Dr. Charles Okpani, and to all of our viewers for joining us. Don't forget, your health is your responsibility. So until next time, speak up, check yourself, and stay informed. The power to ask questions, the power to seek help, and the power to save a life may be even your role.
So, thank you very much.
Start it, share it, pass it on. Follow the Common Cancer Foundation Plus TV network and ACON on all our social media platforms, and join our growing community of warriors, survivors, carers, and advocates. Together we fight, together we win. We'll see you soon, and check us out and get on top of your health. Thank you, Dr. Pani, for being with us.
Thank you very much for having me. I really appreciate.
And we'll see you soon. See you next week.
Yeah.
Bye, everybody.
Yeah,
See you next time.
Bye.